Well, as a researcher in 2022, personally, I think one of the things that makes me most excited is having in-person meetings again. Research is a community effort. It's a team sport, and it brings together a community, a global community, and having the opportunity to share science and collaborate in a face-to-face way is a really big deal. And so the ESC in Barcelona was a wonderful meeting, and I think this American Heart Association meeting 2022 is going to be really wonderful in a way to sort of accelerate science and accelerate sharing and collaboration. So that's one thing. I think the second thing that is so exciting is the evolution in technology of medical therapeutics as we think of novel technology, small interfering RNAs, even gene editing therapies to address some of the core issues with cardiovascular disease, the core risk factors. So if we think of more scalable interventions that can be achieved earlier in broader populations, we can think more about primary prevention and even primordial prevention. But I think the notion of not just treating the sickest in cardiovascular disease, but preventing the onset of disease or preventing the worst manifestations is very, very exciting. And I think there are ongoing trials looking at GLP-1 agonists. There are obviously ongoing trials looking at lipid modifying therapies in earlier patients with earlier stages of disease. As we think about those things, as a patient, as a clinician who sees patients with really severe complex peripheral artery disease and vascular disease, the notion of not just treating those worst manifestations, but preventing the onset of that disease is so exciting.
Brilliant, thank you. And secondly, what is your advice for young cardiologists?
Well, I think for young cardiologists, for people early in their career in cardiovascular disease, I'd say this: you've chosen an area of tremendous potential and excitement. Cardiovascular disease remains the number one killer and a dominant driver of morbidity. And so you've chosen an area where you can make a huge impact. And I would encourage you to choose an academic pursuit, an academic career, and to engage in science. It is so exciting and rewarding, and it's the greatest privilege that one can have to not only see patients in the clinic day to day, but then to spend time really understanding how to move the science forward and improve the provision of care for populations. So I encourage you to stay excited, to engage and to participate in academic pursuits.